Welcome back. This section of the show is called Ask FPA. If you have a question, you could send it to tv@fpalex.com and include your name if you would like for us to use it on the air. Tonight's question is, when should I come in to get a skin cancer screening? And here to help me answer that is Dr. Todd Clarke, who is a dermatologist with Dermatology Associates of Kentucky. Boy, I'm having trouble getting everything out tonight. All right, now, so if you got a freckle that changes or you're worried about it, you come in and get it looked at, or you just come in and get a check anyway?
Yeah, usually I recommend people about the age of 25 come in and get a screening. Skin cancer is pretty uncommon until about that age. The incidence of melanoma is very low and stable until about the age of 25, and then it really shoots up. That being said, if you have a skin growth or lesion that's changing, it's always a good idea to come in and get it checked out. Anything that's new and not healing should be looked at.
Now you use the term melanoma. So what's some warning signs that this is bad?
Well, melanoma is a very aggressive type of skin cancer that develops in the skin from the cells that make our pigment, and it usually comes about as it can actually form within existing moles, or it can actually form what we call de novo within individual cells on clear skin. It's usually an irregular dark brown lesion or growth, although not always, unfortunately, but that's usually the way it presents. Moles that are changing, moles that are itching or bleeding, those can be signs as well.
Okay, so who's at risk for melanoma?
Well, risk factors, the main risk factor is very fair skin. Other risk factors would include blonde hair, blue eyes, family history, multiple sunburns in your lifetime, previous tanning bed use, or individuals who have an increased number of moles, particularly individuals with 50 or greater moles on their body.
Is the size of a mole important?
It can be. Melanoma is very uncommon under about 6 millimeters, which is about the size of a pencil eraser. So that's one of the signs that we look for. You may hear people talk about the ABCDs of melanoma. That stands for asymmetry in color, meaning that one side of the mole doesn't look like the other. Border irregularity, meaning that it has jagged edges to it. Color variation, meaning that there's more than one color within the lesion. And then diameter, which is what we just discussed, diameter greater than 6 millimeters. Those are all signs.
Now you mentioned the sun, okay? There's so many people that love to be out in the sun, sit by the swimming pool, go to the beach. Did they just not do it, or wear sunscreen, or what's the risk?
Well, we don't really encourage people to stay out of the sun completely, because you need some sunlight to make vitamin D. So generally about 10 to 15 minutes of sunlight per day is a good idea. Prevention of skin cancer really revolves around sun protection when you're in the sun, and that includes wearing a sunscreen, a good water-resistant sunscreen. We typically recommend an SPF greater than 30, and we typically recommend you apply that 20 to 30 minutes before going out into the sun, and you reapply it every 2 to 3 hours while you're in the sun, especially if you're swimming or sweating. That's the main reason that people get sunburned. They don't reapply their sunscreen.
Okay. Now, there's also other lesions that are not necessarily skin cancers but can lead to it. And I use the term actinic keratosis.
Sure.
or sun damage.
Sure.
How do you know the difference, and what do you do with those?
Well, melanoma is by far and away responsible for most deaths that are attributed to skin cancer, but there are other types of skin cancer that are much more common than melanoma, which can usually be handled more easily. Those include basal and squamous cell carcinomas. You mentioned a precancerous lesion, that which we would call an actinic keratosis. They usually present as little scaly red areas on the skin, on sun-exposed areas. Those can eventually evolve into squamous cell carcinoma, which is another type of skin cancer. Like I said, much less aggressive than melanoma.
Most of those are treated freezing surgically.
Yes, sir.
And so, one other thing before we go, a lot of my patients are elderly, and they have these spots on them, and I always tell them they're either maturity spot or wisdom spots.
Sure.
They're not always melanoma, but they can be a seborrheic keratosis, which
Exactly.
can mimic that.
Exactly. And unfortunately, they can look a lot like moles and melanoma, the seborrheic keratosis. Basically, it's a thickening of the top layer of skin, the epidermis, and they can get very dark and very irregular. They can have very irregular pigment distribution, which can make them look a lot like a skin cancer. It can be even hard for us to tell.
All right. Well, that's great information. So if you have something on your skin that's changed, make sure and see your dermatologist or family doctor.